Acupuncture long COVID relief. Hello, I'm Adam White, licensed acupuncturist for healthcmi.com. Today, let's cover acupuncture for the treatment of long COVID. This is listed by the CDC by many terms. Long COVID, post-COVID conditions, post-acute sequelae of SARS-CoV-2 infection, chronic COVID, even long-haul COVID. Bunch of names given to the same thing, basically symptoms persisting from weeks to even years after COVID. Note that the CDC says that there is no test to diagnose post-COVID symptoms, and people may have a wide variety of symptoms that could come from other health problems. This is basically the official U.S. government way of saying we're scratching our heads a little bit and we're not sure. But in traditional Chinese medicine, acupuncture, herbal medicine, we do know quite a bit about what's going on here. One, because in China we dealt with this in 2003 with a different COVID outbreak and the sequelae from all of that, and gathered a lot of research and data on that with acupuncture and herbal medicine. And now we're seeing a lot of clinical case histories that do fit into distinct differential diagnostics within traditional Chinese medicine, so we can apply acupuncture and herbs effectively. So let's just briefly talk about the CDC listing of the basic symptoms, and then we'll get into the acupuncture treatment, what people can expect, and how quickly they can expect recovery. I've treated myself a fair amount of post-COVID syndrome, and people have done extremely well regaining their sense of energy, maybe opening up their sinuses, stopping the headaches, getting some energy back, all of this. We'll get into this in a little bit and the research supporting it. First of all, the CDC lists COVID symptoms, and they even, quote, say it's hard to explain and manage, unquote. In many cases, they don't really understand a lot of the post-COVID syndromes. But in traditional Chinese medicine, we know it's not that difficult to understand. And why? Because, to put it in layperson's terms, the COVID, the virus wipes out the internal system, weakens the internal organs, right? As a result, a myriad of symptoms can occur as a result of exhaustion and fatigue and basically problems with the immune system. So the CDC lists fatigue, post-exertional malaise, anxiety, depression, difficulty thinking, headaches. They list joint and muscle pain, fever, sleep disturbances, smell or taste changes, difficulty breathing, respiratory symptoms, coughing, chest pain, palpitations, heart symptoms, neurological symptoms, pins and needles feelings, stomach pain, diarrhea, digestive symptoms, rashes, menstrual cycle changes. Those are some of the more common post-COVID syndromes. So let's look at some research now. One set of researchers, Williams and Marco, note that acupuncture, and I'm quoting them, quote, acupuncture exerts an overall regulatory role through multi-target effects. The body systems influenced by acupuncture include interconnections between neuroimmune functions. Acupuncture can alleviate many of the clinical symptoms of COVID-19, including headaches, myalgia, and abdominal pain, unquote. So if you want to see this entire article and all the details and the actual references to all of the research, simply go to healthcmi.com. And at healthcmi.com, click on News. In the newsroom, you'll see an article published 7/14/2022, so July 14, 2022, entitled Acupuncture Produces Long COVID Relief. That news article gives you all the information that I'm covering here and includes the citations, the references to the specific research we're talking about. Again, the article is entitled Acupuncture Produces Long COVID Relief, published at healthcmi.com, 7/14/2022. So let's look at some more. Hahn and others, and different set of researchers, and this is all from that research at healthcmi.com, they note, quote, acupuncture treatment of COVID-19 was associated with suppression of inflammatory stress, improving immunity, and regulating nervous system function, including activation of neuroactive ligand receptor interaction, calcium signaling pathway, cancer pathway, viral carcinogenesis, Staphylococcus aureus aureus infection. They add, quote, our study uncovered that anti-inflammation, immune activation, and nervous system modulation were primary therapeutic pathways of acupuncture against COVID-19. But wait, there's more. Researchers from the University Hospitals of Cleveland Medical Center in Cleveland, Ohio, Case Western Reserve University, and University Hospitals of Cleveland Medical Center published a case history showing what an actual patient would go through. So it was a very detailed case history of a specific long COVID patient. The patient had long COVID, had fatigue, loss of sense of smell. We call that anosmia, chest pressure, palpitations, and more symptoms. So this person was really wiped out. And they note, quote, the patient's chest pressure and palpitations resolved after one acupuncture treatment with 6 additional treatments spanning 9 weeks, overlapping with symptom-titrated physical activity. She recovered completely and resumed her normal exercise. So they were giving her some lifestyle changes for physical activity to get her back to her normal self as well. That's typical as part of a normal traditional Chinese medicine treatment protocol that would include everything from Chinese medicine dietetics, use of foods to heal the body and avoiding certain foods, herbal medicine, acupuncture, as well as bone medicine like Tui Na massage, things like that, as well as meditation and exercise and breathing exercises. And that, so that could include Tai Chi Chuan, Qigong, many things like that. So that makes sense to put some physical exercise in there because without proper exercise, the human body is very unhappy. The researchers published the treatment protocol for the patient. And some of the highlights were use of stomach 36. They used it for clearing lingering heat and dampness. Lung 7 they also used. They used triple burner 5 GB41, a famous 8 extra point combination in traditional Chinese medicine. And they said they chose that for benefit, harmonizing the yin and wei, circulating yin, smoothing liver qi, and regulating the Xiaoyang channel. Although traditionally that combination of triple burner 5 and GB41 is for treatment of the retroauricle cheek and outer canthus, overall the treatment was to benefit the immune system, drain the dampness, and regulate the yang wei and dai mai vessels. Lung 7 is also the confluent point of the conception vessel, so they use that, which is great. And other acupuncture points included GV20, kidney 3, liver 3, spleen 6, and so on. I see GB8's in there, and that must be gallbladder 8 because it's on the temporal aspect of the scalp. Must be for headaches and regulating the Xiaoyang. And they use relatively fine gauge needles, some sarin needles there that they used. And let's see here. Total acupuncture treatment session time was 30 minutes per session. They elicited Dutchy with little twisting and lifting techniques. Overall, it looks like they were very smooth. Most patients can expect a relaxing treatment. Now, what the researchers note was, and I'm quoting them, quote, the patient was relaxed immediately after her first acupuncture treatment and noticed an absence of chest pressure and palpitations later, unquote. After the second treatment, the patient had more overall energy. After treatment 3, the patient notices an improved sense of smell and was able to mow the lawn without labored breathing. After treatment 4, the patient had reduced bouts of coughing. After treatment 5, the patient noted improved cognitive function. And after treatment 6, the patient resumed normal exercise and had no relapse, measured at a 1-month follow-up after treatment 7. So pretty good. That's a great case history. So there's a bunch of research is coming out now and more coming on the way. We always need more to support this. But really going back to the first major dangerous COVID outbreak that was measured in 2003, we do have a lot of data on herbal medicines like Lianhua Qingwen and many others, Qingfei Baidu-san, and how they work really well to treat COVID. And we also are now getting more and more information on the treatment of post-COVID syndrome, long COVID with acupuncture, which is great. This is definitely helping people. There's no doubt about it. My personal clinical impressions, takes a lot of visits. If someone's really suffering, they're just, maybe dizzy, they can't think clearly, they've got headaches, sinus congestion. I mean, they're a mess from it, right? They've been wiped out. So I'm finding 2 to 3 visits per week for like 2 weeks is a good opening hand to really take them up significantly. I mean, at that point, within just a few sessions, in a concentrated amount of time, we are seeing very, very good results. Maybe the sense of smell comes around, maybe the energy is better, less headaches, better sleep, things like that. In some cases, we're still relieving low-grade fevers, so yin deficiency fevers still need addressing. So the point selection has to go along with differential diagnostics as far as acupuncturists are concerned. But in terms of the patient, I would say that the expectation should really come in more than once a week. Once a week is okay, but it won't do it. I'd say for the first 2-3 weeks, 2 to 3 times a week or more if possible. But even 2 to 3 times a week for 2 to 3 weeks should demonstratively change the patient's lifestyle and reduce symptoms. That would be consistent with not only the research, but my own clinical experience. So I wanted to share a little bit about that, how acupuncture produces long COVID relief. Visit healthcmi.com to learn more. Thank you for listening. I'm Adam White, licensed acupuncturist. If you like this podcast, don't forget to like and share. Thank you so much.